Yes, ma'am. Clinical teaching is the teaching of nursing students in the hospital or clinical setting.
Okay, thank you. So when you will have your RLE or your duty in the ward, in the hospital, I mean, so before when you do your rounds after the endorsement, there are cases when the instructor will discuss about the disease process of the patient and they will use medical terms so that patient cannot understand what you are discussing. So this is also done no, sometimes together with the doctors. So itong ginagawa sa picture, if you look at this, no, the doctors, ito siya yung consultant. Can you see my cursor?
Yes, ma'am.
Yes, ma'am.
Okay, ito siya yung consultant. These are the medical students, no? Or this might be the medical student or the resident on duty. Kasi during the rounds of the consultant, kasama yan sila. The same with us when we are having our uh, duty. After the endorsement, we will do the rounds to check what is being endorsed is correct. No, pag sinabi ng previous nurse, patient is with catheter, no, draining to 100 cc of urine or draining to 700 cc of urine. So, you will do the rounds. When you will do the rounds, you will have to check kung talagang merong catheter ang pasyente as endorsed. No? Gi-endorse niya, the patient is with IBF of D5LR 1 liter at 120 cc infused on the right metacarpal vein. So sa right. So during the rounds, you have also to check if there is really an IV, what is being mentioned. D5LR na being infused on the right side. So during the rounds, aside from checking what is being endorsed, sometimes clinical instructors will discuss the topic or the disease process of the patient, especially if it is a rare case. No? Yung first time niyo ma-encounter sa ward, halimbawa, sickle cell anemia, hindi siya common. So, pagdating ninyo sa patient, i-discuss ng instructor yan, no? And then, doon niyo sasabihin kung what are the signs and symptoms that you can see to your client. So, we are using medical terms so that patient as well as the watcher cannot understand what we are discussing. So, if you're going to ask questions to your clinical instructors, as much as possible, you are also going to use medical terms. Follow? So it is not only in the classroom setting that there is a teaching process that will go that is ongoing, but also in the ward. So as you go on with your duty, ipapakita ng teacher sa iyo kung ano yung gi-endorse. So try to check how to check kung tama ba yung gi-endorse niya, D5LR 1 liter. So, titingnan niyo yung bote, how to count, gi-endorse niya, meron pang IV fluid doon na 700 cc. Ipapakita din ng CI how to check why is it being 700. Na may label man niyang bote. So, yun. So, these are the clinical teachings that will happen as you go around with your duty. Or it is not only during the endorsement, after the or during the rounds, but as you go along with your duty for 8 hours, no, meron siyang mga uh, teaching ang clinical instructors that will occur any time of the day during your duty. So kaya you have to be uh, tawag yan, you have with you your jot down notebook in your pocket as you go on with your duty. You have with you your word notebook. So, pwede mo isulat doon whatever you have discussed during the rounds or during the course of your duty. Na? Okay, next we have purposes of clinical laboratories. Clinical setting offers the students the opportunity to apply the theoretical concepts, rationales or rational, procedures, and propositions that they have learned in the classroom. If you notice, try to observe. I mean, if you are going to have your RLE in the ward, no, what is being, halimbawa, nagfunda kayo ngayon. You cannot go on duty without the funda. Now, these are the uh, things that you have learned in the classroom and that you will be applying as you go on with your duty in the settings, in the clinical settings. So, hindi ka pwedeng mag-duty sa OR that you do not have the concept of OR. Na wala ka pang uh, theoretical concepts regarding OR. You cannot have your duty in DR if you do not have theoretical concepts about DR. Now, you cannot have your duty if even if you are already second year and you are supposed to have your duty in DR, but during the skills lab as well or during the first day of your duty, you are absent. You cannot be accepted in the ward because you did not join with the skills lab. So to be accepted in the ward, you will have a special skills lab. One-on-one kayo ng clinical instructor mo before you will be accepted in the ward. So, hindi pwedeng magdiretso ka lang ng mag-duty. No? Even the other courses, like MedTech, we have MedTech. Our MedTechs will have their theories, theoretical concepts as well, from first year to third year, and they will have their duty by the fourth year. So, lahat ng theoretical ideas is also received by the students before they will be exposed. The same with you. You cannot have your duty if you did not undergo with this particular concept. Okay, as you go on with your course, pag second year ka na, sa isang subject mo, 3 or 4 na teacher sometimes sa isang subject. That is the theoretical concepts that we have. By concepts ang atin. So, halimbawa, ang subject mo is NCM 202. No? Sa midterm mo, iba yung prelim mo, ibang teacher. Midterm mo, ibang teacher. Finals mo, ibang teacher. Pero isang subject lang yan. No? Pero different concepts sila. Sa prelim mo, ang gidiscuss ng CI is about community. Sa midterm mo, ang gidiscuss ng CI is about delivery room. Sa finals mo, ang discuss naman ng other clinical instructor is about OB-GYN. So, hindi ka pwedeng mag-duty sa ward if you failed on that different concepts. You follow? Hello?
Yes, ma'am.
Yes, ma'am.
Okay. Next, you read for us, Mr. Aventura.
So, skills learned in the nursing laboratory are perfected in the clinical area. Number 3, skills of observation, problem solving, and decision making are refined and honed in clinical setting.
Thank you. So the skills that you have learned, that is why you have your classroom setting Funda RLE, no, which is your also a laboratory that will help you to what you call this one, to develop your skills so that by the time you will arrive in the ward, you know already how to do it. No? Hindi naman pwedeng when you are having your duty in the ward, wala kang idea how to do bed making, wala kang idea how to make how to do blood transfusion, no? Wala kang idea how you are really a novice upon exposure in the ward, but you have the theoretical ideas in the classroom setting. So yun lahat, makikita yung skills mo when you will be in the ward already. So yung nasa classroom setting mo, like sa Fonda, no? You have also in anatomy. So sa anatomy, you have performed already yung how to check for the tawag niyan yung urinalysis, no? 'Di ba? Meron kayo how to distinguish the isotonic and the hypertonic if you remember your anatomy, no? Because you will be in the ward, no? You will encounter fluids that you will identify also if it is isotonic or hypertonic. So hindi lang siya hanggang classroom setting lang, no? So the theory that you have learned in the classroom, in your laboratories, will be applied already in the clinical settings. This tawag nito yung skills, no, will be polished by the clinical instructor in the ward, no, after your fonda, and we are you are observed by clinical instructors if how to decide when particular problem will occur. Halimbawa, may fever ang pasyente mo, no? Alangan mo ko, ma'am, nag-fever akong pasyente, unsaon na ako to, no? So, of course, you can ask your CI, but your decision making is also observed by your instructor. Because when you become a nurse, you have also, di ba? Pag nurse ka, dapat nakafocus ka sa trabaho mo. And aside from that, kaya sinasabi, you leave whatever problems you have at home when you will go on duty. Kasi decision making is very important because we are dealing with life. No? So yan siya, that will be polished by your clinical instructors in the ward already sa clinical setting. Okay? Next. You read for us, Miss Oxtero. Miss Oxtero, nag-breakfast na si Oxtero. Miss Oxtero, Miss Bandigan, Miss Bandigan.
Yes po, ma'am.
Okay, you read for us.
4. Students are aided by the clinical instructor on how to organize all the data that they were able to compile, as well as the intellectual and psychomotor skills they must perform.
Thank you. So when you will have your duty in the ward, no, you will have your data collection about the patient, why patient suffers particular disorder. More or less, you have also going to make a quick plan of care with regards to the disease process that the patient is having. So medyo ano siya, how to get, kasi meron kayo in the, I think you have in your health education subject, do you have? How to do an assessment with your client, how to get the data of your client. So doon naman sa ward, no, we have that one in a health education subject sa classroom setting, but that will be applied in the ward as you collect data with your patient. Hindi tayo, walang patient that will, especially if you discuss about the reproductive system, no, about the penis as well as the vagina and the breast, no patient will submit to you to examine the penis as well as to examine the external genitalia. But the students, no, should find a remedy how to collect data regarding on this topic. And you will be first time, of course, on your clinical exposure, first duty, you will be guided by your clinical instructor. But as you go on with your duty, nasa second year ka na second duty mo na, third rotation na, fourth rotation na, no? Guided by the CI, but it is more of your performance. Sa second year ka pa, that is, kaya nga sabi ko sa students, masarap maging masarap maging mag-duty sa hospital if that is your first exposure because you have all the excuses. Diba? Ay ma'am, hindi ako makakuha ng data sa patient ko kasi ganito, ganyan. And then the CI understood that you are still novice. Pero pag nasa third year ka na, fourth year ka na, you don't know how to get it, magagalit na ang CI mo sa iyo because you are already taught on the classroom as well as on the first exposure of your duty. So, lahat yan, no? Meron tayong process of how to collect data on our client. This is for your NCP as well as your case study. Why patient experience a particular disorders. No? So kaya magamit mo lahat ng domain if you're going to collect data with your clients. Okay? Next one. Next, you read for us, Miss De La Cruz.
Number 5, cultural competence, which is the ability to interact meaningfully, properly, comfortably, and effectively with culturally diverse patients will be developed.
Thank you. Okay, it is as nurses in the ward, no, we have also to respect the different cultures of our client. We will not insist on what we know. We will not insist on what we believe, but we have also to respect their cultural aspects. No? Kasi may mga patient like Jehovah's Witness. Do we have Jehovah's Witness here? Meron ba dito? Ang Jehovah's Witness will not receive blood transfusion even if they are dying already. So, hindi naman natin pwedeng i-insist yun. Ay, dili, sir. Tusukan tagyog kag dagom. No? But we have the waiver when the patient will refuse with the what you call this one, will refuse with the different procedures that we're going to give them, no, for their uh, benefit naman yung mga procedures. Pero merong iba nag-refuse, but we have the waiver for that, no. So we have as nurses also, no, sabi nga nila nurses are very toxic daw, no, in the ward. I don't know, but perhaps because of the what you call this one, the ratio of the patients, no. Sa Pilipinas kasi we have 1:30, 1:60, no. Pero sa abroad ka, if you're working abroad, we have only 1:1, 1:2. So nurses do not have the reasons to become toxic already, no. It is not also a reason that you will become toxic in the ward, no? Because you have a lot of patient, kasi yun ang pinasok mo, no? Kung ayaw mo mag-nurse, di huwag kang mag-duty. Kasi lahat yan, I'm telling you. No, I'm not discouraging each one of you, but I'm just telling you the scenario in the hospital. Everything, mapunder ang, busted ang light, it is the nurse that they will call. If the comfort room is out of order, it is the nurse that they will call. If patient is with problems regarding halimbawa hindi siya makatulog, they will call the nurse. If the patient cannot eat well, they will call the nurse. Lahat yan, nurses, no? Although we are a team in the ward, but sad to say, na nurses talaga ang nakikita. No, lahat yan, hakot ng nurses. And that is the reality in the Philippines. You have all the actions, you have all exhausted ang mind mo, but you have the very least person that receives the low salary. No? So wala tayong reason, wala talagang reason to become more, tawag niya, na magiging toxic tayo. Merong iba na because of their culture, no? Na hindi natin mabigay kung ano yung dapat nating ibigay for their own benefit. Pero because of their belief, no, minsan hindi natin mai-apply yung gusto nating i-apply, no? Kung halimbawa, gusto mo may fever siya, no? Katulad ng sample ko kanina na Jehovah's Witness. Masyado na mababa ang platelet, no? Pero it was ordered to have transfusion, platelet transfusion, but the patient refused, no? So wala tayong magawa, no? But we have to let them sign with the waiver. So we have also, meron silang mga belief that they will adhere, no? So we have also to respect all of this. Lahat, kultura, iba-iba ang kultura ng tao. Kahit na isang Pilipino lang tayo, iba yung Ilonggo, iba yung Bulanon, iba yung Cebuano, no? So, iba yung Ilocano, merong iba-iba talaga. So we have to respect all of this, no? So we have to make our patient more tawag niyan yung to the level na i-explain mo na lahat kung ano yung maganda sa kanila, no? Pero kung they will not accept what you have explained, then we will surrender ourselves. But we have to refer na meron tayong mga organizations or meron tayong mga group of people that will be this particular patient will be referred to them so that they will really understood what is needed for their benefit, no? So yan, cultural competence, no? Yung tawag niyan, yung interaction mo naman sa patient mo, no? Yung halimbawa tawag niyan yung English ang hapon ang pasyente mo. Yan din, meron din tayong mga problema diyan. If patient is Japanese and you have difficulty to explain the procedure, no? So meron din tayong mga good for San Pedro Hospital because we have Thai doctors, we have Japanese doctors, we have also Korean doctors that will help to explain with all of these procedures that we are going to give to our clients. So hindi masyadong difficult for us. Pero we have to respect whatever is the culture that they are adhering to. Okay, next. You read for us, Mr. Estrella.
Number 6. Learn the skills of socialization, which behaviors and values are acceptable or unacceptable, and where responsibility and accountability for one's action is demanded and expected.
Okay, learn the skills of socialization because we have to handle different types of individual in the hospital, no? So merong high intellectual individual, highly intellectual, meron namang no read no write that you're going to handle, no? Even if you're in the private hospital, no, not only in the government hospital. Sa government hospital, different attitudes, different cultures that you will encounter, but we have to learn how to handle this type of persons, no? It is very difficult also sometimes, no? Kasi especially we have to remember once the patient is admitted, patient is having more anxieties, no? So walang pasyente na na-admit na walang anxiety talaga. Meron yan, lalo na if they are the breadwinner, no? So we have to deal with them on how to kung saan ka papasok o kailan ka papasok, how to explain with this particular procedure, no? Kasi when you try to get in and explain the procedures, hindi mo pa natapos mag-explain, mag-refuse na, no? They will say no. No kaagad. Tapos sabihin mo, pagani ko kahuman og-explain, nag-no na siya, ma'am, no? So we have to have an adjustment with them, no? You have to tawag niyan yung dapat yung skills of socialization will be observe mo kung saan, kung kailan ka papasok doon sa pasyente mo, no? Your responsibility, hindi yung ibig sabihin na, maldita na pasyente yan, ayoko niyan sa kanya. Bahala siya, kaliturahon siya diha. Magkisi-kisi siya diha, no? Wala tayong magawa because this is our responsibility. Whether you like it or not, no? Kahit na mabaho masyado ang pasyente mo, then you have to take care of your patient. Meron tayong responsibility towards them. Meron din tayong responsibility towards ourselves. No? Every time you have your duty in the ward. Okay, next. We have here the different models of clinical teaching. So this is what you will see as you go on with your duty. So one clinical instructor is in charge of 8 to 12 students in the clinical area based on the requirements set by the CHED, no? So, meron tayong guidelines, no? CMO guidelines that will help the school to to base kung ano yung dapat gawin doon sa mga estudyante. So, the ratio of student to client depends on the objectives and the capacity of the student. The ratio of the students to client is Level 2, 1:1, the first semester. Level 3 is 1:2 or 3. Pag first sem, then, ayan, level 4 is 1:5. if it is first semester. Second semester, sa level 4 is 1 to 6. Level 3 is 1 to 3 or 1 to 4. No? And level 2 is 1 is to 2 for the second semester. So, try to imagine this one. Huh? Okay? So, the prescribed faculty-student ratio is level 2. Level 1 kayo, no? So, wala pa kayo dito. Pero actually, ang level 1 and level 2 is just the same. So, level 2 is 1 CI with 8 students per semester. Yan. But look at how your clinical instructors, how many students your instructors are handling. More than, no, more than what is required by the CHED. Okay? So, ang iba, so just like sa fonda ninyo, sa isang CI, minsan 12 kayo na students, no, mag-RD. Kaya you cannot tell na matapos kagad ng isang CI ang isang demonstration na allotted time for the demonstration because of the number of students na more than what is expected, no? For second sem naman tayo ngayon, so dito na kayo. 1:8 supposed to be. Isang CI, 8 estudyante. Pero sa inyo, I think 1:12 or 1:13 ang students. Sa level 3, 1:10 or 1:12. But what the CIs are handling for this semester is sometimes 1:17. Akin nga, level 2 is 1:17 ang RLE. Can you imagine that one? If you will be in the ward, no, how could the clinical instructor, no, isa lang ang katawan ng instructor mo, sa 8, nahihirapan na ang CI. Ngayon, 17 ang handle ng bawat CI. No? Kaya hindi mo siya, with the procedures that we are having, no, sa return demo, we have difficulty. That is why we have to extend our time. No? Na instead na 1 day lang ang demo, ginagawa minsan 2 to 3 days because of the extended number of students that the CI is handling. Level 4 is 1:12 or 15. Tapos mag-absent pa sometimes ang CI. Isang CI nag-absent sa isang ward kasi nagkasakit, whatever. No? So yung students niya will be distributed to the different CIs. So mag-handle ang CI ng 1:17 or sometimes 1:18. Madagdagan pa yan siya, mag-abot pa ng 1:23. No? Kaya if you are the student, no, kung meron kang kailangan sa CI, I really suggest to my students, if you need my presence during the procedure, you have really to call my attention. No, kuhita yun ko. Ngayon lang nga, ma'am, kana bitang some students will just tell, ma'am, mag-change ako ng dextrose ng patient ko. No, hindi. Kasi minsan ang attention ng CI nasa ibang student. No, kailangan kalabitin mo talaga. Ako, I'm always telling my student to you call my attention pero kailangan kalabitin mo ako. Ma'am, mag-change ako ng dextrose. Ma'am, mag-empty ako ng catheter. No? So, I will know what you are doing, or if that is your first time to do the procedure, I can go with you. So, pwede kong sabihin, wait for a minute, tapusin ko lang ito. No? So, if you are a student naman, please do not make some, tawag niyan yung, gumagawa kayo ng procedure sometimes without the knowledge of your CI. Or you will just say, ma'am, the staff is looking at me. Depende yan. No? If the CI will allow you to be handled by the staff, so pwede. Pero pag sinabi na sa'yo, no, you call my attention. I will be the one to be with you. So you have to you really have to call the attention of the instructor. Ha? Kasi ito yung prescribed ng CHED. Pero we are more than what is being prescribed. You can't blame kasi madami din ang enrollment. We are hiring of nurses, but until now, kunti lang naman nag-a-apply. Okay? Wala nang nurses, nasa abroad na lahat. Okay, next, the students are retained in the nursing skills laboratory room until they are proficient in the skills required by a certain nursing procedure. You will have your return demonstration. It is not only during the Fonda lab, but as you go on with your duty in the ward, before you start with your duty, meron tayong tinatawag na skills lab. So, ang duty is only in one area. Your duty is only 1 month. So, 1 month ka dito ngayon sa PEDYA, 1 month ka next time naman dito sa DR, 1 month ka naman doon sa OR, mga ganyan. So, ilipat-lipat kayo. No? So, kung 1 month ka dito sa isang area, no? Before you start with your duty, we have what we call the skills laboratory. So in the skills laboratory, this is the time that you will have also another demonstration of the procedure, unless the CI will be the one to demonstrate without the return demonstration. But in some areas like OR, DR, ICU, as well as NICU, no, sa newborn, CIs will ask the students for another return demonstration. So if I will demonstrate how to handle the delivery of the newborn, after that, after my demonstration, the students will be asked to have a return demonstration. So if you are not skillful enough to have your demonstration, no, the CI is not amenable to what you are demonstrating, you will not be accepted in the ward. So, pwedeng si CI magsabi na, ma'am, I am afraid that this particular student will commit an error in the ward. I will not accept this student in the ward. So, pwede kang ibalik doon, i-retain ka lang doon sa isang area na gidutihan mo. No? Can you follow? Hello?
Yes, ma'am.
This is the reality, ha. Hindi ko kayo tinatakot. But that is what we are doing this time. No? For this time kasi virtual nga, no? Very advantage sa mga nursing students kasi all of them pass with the skills lab. Lahat sila, no? Pero in the face to face, no? That is the actual scenario that there are some students who are retained in some particular area. Halimbawa, nag-duty siya sa DR. Duty na siya ngayon sa DR, ha? Halimbawa. Pero the CI noted na hindi siya nag-improve, hindi din siya nagiging skillful in that area. So, pwede siya i-retain ng CI. Pwedeng sabihin ng CI, ma'am, hindi siya pwedeng mag-forward sa next level. Hindi siya pwedeng will have another duty in the next area. So, pwede siyang ibalik. No? I-retain lang siya diri sa DR, ma'am. Kasi gusto ng CI, halimbawa gusto ko magiging skillful siya before siya mag-transfer sa next area. So, pwede yan siya. No? Okay? And as I have mentioned, you cannot proceed. No? Kung duty ka na ngayon, you cannot proceed naman if sa previous tawag nito, if during the skills lab, no? Skills laboratory, hindi ka din pasa doon sa standard na hinihingi ng instructor. Okay? A clinical nursing course can be conducted in the classroom area before the students are sent to the clinical area. So this is what I have said. No? Before its duty in the ward, we will have the skills laboratory. In some areas, especially special areas like DR, OR, ICU, we have 3 days a skills laboratory. No? Meron tayong gina-conduct na classroom discussion, no, na before ka i-expose sa ward. Kasi like sa DR, no, halimbawa sa DR, your theoretical knowledge is done when you are on the second year, first semester. But you will be exposed in the DR on the second semester. So, tendency is makakalimutan. Diba? Ang student naman is pass. Diba? Agree or not agree? Pass is past yun. No? So, nakalimutan na yung what is being discussed in the classroom. Pagdating sa ward, no? So wala na. So what we are doing is i-review yan siya in the classroom setting before siya ma-expose sa area. No? Kasi matagal na yun, nakalimutan na ng estudyante. Kaya meron tayong tinatawag na skills laboratory. That is conducted in the classroom prior to your duty. So pag special areas, as I have said, that would be 3 days. So pag ordinary areas lang like ward, it is only 1 day lang. So sa ward kasi hindi namang masyadong hindi masyadong kailangan yung hindi na kailangan i-discuss yung i-remind sila, mga procedures na lang. Unlike sa special area, procedures will be read, demonstrated again, and then ang lecture naman, i-review ng CI bago sila expose doon. Okay? Next, we have preparation for clinical instruction, choosing a clinical and community agency sites. So this is done actually by the clinical coordinators as well as the dean. They will have MOA or an agreement before we are exposed in the area. So our affiliation institution is San Pedro Hospital. That is owned by the Dominican Sisters also. So dyan tayo mag-duty. But we have also community like Agdao, Jacinto, ano pa ba? Sa ano pa yun? Nakalimutan ko yung ibang area, no? Meron tayong mga school exposure, no? Yung sa mga public schools. So meron, and they are the one who choose these areas are the clinical coordinators. They will have an agreement between the community, no, that we will be exposed in that particular area. So meron tayong mga lying-ins. Ang lying-in natin for the DR is we have Perez. We have also in Bahada, no? And before we are exposed because of too many students. We are exposed in the Tagum DRX, no, sa Apocon, and we are also exposed in Digos in the Dominican Sisters Hospital, as well as the Digos Doctors and the Provincial Hospital in Digos. So iniikot yan ng mga CI, no? So 3 days duty lang yan, no? So you will stay in that particular area for 3 days, naka-dorm, of course, no? Together with your CI. Sabay kayo mag-alis, sabay din kayo mag-uwi. Okay? So may travel time. Staff who can serve as a good role models for students and partners of clinical instructors who are aware of their role as members of a teaching hospital or facility. Like San Pedro Hospital. In some other hospitals, we are not involving the staff. But in San Pedro Hospital, we involve the staff in the evaluation of the students. No? Kasi mga San Pedro graduate naman yan karamihan. And they are aware of what they are going to taught to the students. So, during head nursing exposure, during staffing, walang clinical instructor because you will have your 11 to 7 shift, night, as well as 3 p.m. No? I-rotate kayo. You might have your 7 to 3, 3 to 11, and 11 to 7. So, walang clinical instructor that will go with you, but instead, it is the staff who are on duty as well as the head nurse that will follow you up in the ward. Sila yung magiging clinical instructors mo doon. Okay, accessibility and safety of the site. Of course, this is also assessed by the school itself, no? The dean as well as the clinical coordinator. If it is good for learning purposes. No? Drawing up a contract between school and the agency. This is done by the school, the dean, and the coordinator. They will go to different areas like Apocon, no, sa DRX, sa Digos. They will have this MOA, no, the agreement before we will be exposed in the area. Kaya sa DRX, no, as well as SPMC, no, meron yan siyang agreement sila between the school, no, kaya we cannot choose the time that that we are going to have our duty. Kung ano yung binigay nila na slot, that is the one that we are going to receive. Unlike sa San Pedro Hospital, because this is our affiliating institution, so makuha na to tanan. Now we can avail of the time slot, and we can avail of the different shift. No, pwede mag 3 to 11, pwede mag 7 to 3, pwede mag 11 to 7. But in some other areas like SPMC, no, we are given sometimes 11 to 7. So wala tayong choice. So sometimes we are having our duty 3 to 11. No? So that is done by the school dean and the president as well, together with the coordinators. Okay. Next, we have the final preparation of clinical instruction, the student orientation. Okay, before you, even if you are not having your duty, you have your orientation in SPC, right? Nag-undergo ng orientation, wala. Hello? Did you join? Did you join with the orientation?
Yes, ma'am.
Okay, very good. In the clinical setting, if you cannot join the orientation, you will not be accepted in the duty. Take note of that, ha? Para pinaka-importante yan siya. Yan ang sinasabi ko sa students palagi. Pag merong orientation, please attend. Ha? Kaya you will regret later. No? So, sila nag-duty na, ikaw wala pa kasi hindi ka man na-orient. No? And sabi ko nga sa student, gina-joke ko man sometimes, ayaw jud absini ang orientation, pwede ka na mag-absent sa succeeding days. Pero never absent in the orientation. Kaya hindi ka makapasok sa duty mo. Okay, during the orientation, it includes an overview of the following basic policies and procedures. So generally, we have also orientation from the DOH. So that will be conducted in the gymnasium, sa SPC, all levels, lahat ng first year, no? And even the second year, that will be conducted by the DOH personnel. Mga policies, no, procedures. Sa San Pedro Hospital, we have also, it is the staff as well as the head nurses and the president of the hospital will go to the school, conduct the orientation in the gym also. So, nandiyan na yung basic policies, set up, and the facilities that we can avail. The administrative staff done through guided tour and group orientation conference with the chief nurses. So, kung halimbawa mayroon ka ng katulad sa phone, di ba? Meron kayong respective CIs. Although isang classroom kayo, but during the demonstration, merong CI na na-assign sa inyo. So, ganon din sa duty, when you will have your rotation, by group kayo, and you are going together with your clinical instructor, itour kayo sa hospital, and it is the chief nurse also, or sometimes the head nurse, that will accompany you during the orientation. So, bawat ward, ipaila-ila na dito, kinsa ang head nurse, kinsa ang priest, kinsa ang, yan lahat. So, during the orientation, you have to take down notes because you will use that one during your duty. And then, tingnan mo talaga yung mukha niya. No? Halimbawa, ito, si Sister Francilio, ang president ng San Pedro College. Titingnan mo yung mukha niya kasi you might encounter this person in the ward. No? So, hindi lang yan siya, basta makinig ka lang, tapos sige ka text diya, sige ka cellphone. No. You have to take note what is being oriented during the orientation. Okay? Next, group orientation activity should include, so after the whole level, sabi ng orientation, yung sabi ko sa gym kayo, ano, lahat kayo first year, lahat kayo second year. Then after that, meron kayong group orientation with the specific clinical instructor. So doon na, sa group orientation, ibibigay yung objectives sa instructor, no? Parang gumawa siya ng teaching plan. Then course requirements, ano yung mga requirements ng students, accepted students' behavior and decorum, as well as other expectations. So sa hospital, kung if you're in the ward, no, sabihin na that you're not allowed to loiter in the hospital. If you are having your duty in pedya, dyan ka lang sa pedya. Hindi ka pwedeng after within your shift, no? Halimbawa, tapos ka na sa trabaho mo, gusto mo umupo, pumunta ka doon sa kabilang ward. Kasi nandun yung kaklase mo, bawal yon, mga ganyan. So the instructor should be guided by a clinical teaching plan. We have yung teaching plan na ginagawa. No, it is the clinical instructors that do that submitted the teaching plan to the dean, approved by the president. Yun ang guide ng clinical instructors when they will have their orientation in the ward. So, meron tayong mga handouts or written guidelines that will be given to the students during the orientation. Sometimes meron, sometimes wala. Kaya makinig lang during the orientation. Okay. Next, the content or the format of the teaching plan. Okay, description of the learners, the focus of the clinical experience, the description of the learners. So, sino ang listeners mo? No? Halimbawa dito sa clinical instruction, clinical teaching plan, ang description of listeners, nakalagay minsan is the level 2, level 2 PSN students. Ayan. Focus of clinical experience, halimbawa is pediatric exposure, pediatric clinical area. Pediatric concept, I mean. Sa setting, so San Pedro Hospital Pediatric Ward. So alam na, ito yung guide ng mga teachers. Okay? Next, briefing or orientation. We have to give this to the students on the first day of duty. No? Kasali doon sa skills lab. Kasali doon sa skills laboratory before you will have your duty in the ward. So, ibigay yung objectives, ibigay yung requirements, what are the specific activities, and the nature of evaluation, as well as the grading system. So, in every exposure in the ward, in every area that you will be exposed, you will have an orientation on the first day of duty. So, as I have said, 1 month you will be exposed in the pedja. After the pediatric ward, the coordinator will post the schedule of the students with the respective clinical instructors, no, before on the first day of duty on the next rotation, meron na naman kayong another briefing or orientation with all of these activities. Include doon ang grading system so that you will be guided what are you going to expect in the ward. And aside from that, at the end of the clinical rotation, clinical instructors, no, regarding sa grading system, the clinical instructors can recommend to the dean as well as to the coordinator a particular students that will receive the different awards. Halimbawa, you are very skillful in the delivery room. So, pwede mag-recommend ang CI mo na best in delivery room area. So, meron tayong mga awards that will be given on the 4th year level before your graduation. No? Meron tayong separate na nursing awarding, nursing pinning. So, doon ibibigay yung mga awards. So, that is why you in every area that you will be exposed, there is always a grading system that will be given to you. I-inform ang students what is the nature of evaluation and the grading system so that you will be aware that at the end, meron tayong mga clinical awards. No? Kasi minsan, wala ko kay balo, ma'am, naday na best. Ayan, hindi ka nakikinig sa orientation. Kaya hindi mo alam. So, every exposure in the ward, meron yan siya on the first day of duty. Ito yung sinasabi kong do not absent on this day of orientation because if you are absent or late, you will not be accepted in the ward. If you are late for more than 30 minutes, what happens to you? Di ba, meron yan sa orientation sa Fonda RLE? Do you still remember? Anybody from the class? Ano daw? Ano mangyayari sa'yo if you are late for 30 minutes? Hello?
Considered absent, ma'am.
Okay. You are absent for 1 day and you will be extended for 2 days. No? So, sayang. If you are extended, you will pay for that. And if you accumulate 15 extensions, you cannot join with the graduation as well as the pinning. So, diba? Sayang. Okay? So, kaya mag-absent ka na lang sa next day. Wag lang sa orientation. Okay? Binigyan na kita ng idea. Schedule of activities weekly. Meron din ang CI, the Clinical Teaching Plan, what to do in the ward. Now, hindi lang basta pupunta si CI sa ward na wala siyang plan. Now, the same with you, that is why I'm telling with the student, try to practice this time when you go on a class, a virtual class, every day you have to have an objective. No? You have general objectives, but daily you have to have an objective and evaluate at the end of the day if you have come up with your objectives. This is what you're going also to do in the ward. Ang CI merong teaching plan, but the students is also having a schedule of activities per day, no? That you are going to follow and you at the end i-evaluate mong self mo para hindi masayang yung araw mo na wala kang ginagawa, no? So at 7, receive the endorsement. Actually, our schedule of activities will start at 6:30. Did you know that? Sa Fonda? 6:30, we will have our checking of attendance at the gymnasium. If you are 7 to 3 or 3 to 11 shift. Except the night. Kasi ang night, sarado na ang San Pedro College, no? If we are on a, tawag niyan, on a face-to-face learning. So, 6:30, nandyan na yung students, naka-fix na with the cap, ang girls, malinis ng shoes. By 6:30, we will start with a prayer. So, ang CI minsan, wala pang 6:30, nasa faculty room na yan. Kaya you will notice the CIs are bringing with them food kasi doon na yan kakain habang nag-fix sa sarili. No? Doon na kakain sa faculty room. So, by 6:30, wala pang 6:30, bababa na yung CI. Then, lahat kayo together with the respiratory therapist, no? We will have our prayer and pambansang awit. Iyon ang ginagawa, no? Routine procedure yan. Prayer, and then pambansang awit, panunumpa sa bayan as well. No? So, every day, you have to prepare yourself kasi pwede kang i-pick up, random man ang pick up ng CI, that you will be the leader for the day. O, ikaw mag-lead sa prayer, ikaw mag-lead sa what you call this one, sa pambansang awit. No? Ikaw mag-lead sa ganyan. So, lahat yan. After that, mag-check to si CI ng attendance. After the checking of the attendance, bibigay si CI ng special instructions, then that's the time you go to the ward before 7 o'clock because at 7 o'clock, you will have your endorsement already. Position yourself to the most comfortable one in the nurse's station to receive the endorsement. So, ang endorsement, we have also the process of how to receive an endorsement. And you have to listen carefully. If you cannot follow the endorsement, do not disturb your classmates because the endorsement is too fast and the staff voices are too slow. Huh? I mean, too fast, not too soft, na ano siya, na hindi clear ang endorsement sometimes. And we are using abbreviations in the word. So, ikaw, if you cannot memorize the different abbreviations, medical abbreviations, na maware lalo ka pag abot sa word. Kaya pagtingin ng CI mo sa endorsement notebook mo, wala kang nasulat, kundi date lang. Kaya we will have a practice this one pag first year ka pa, pag first exposure. Okay? Then after the endorsement, no? After the endorsement, we will conduct a round. Before the rounds, the clinical instructor will give an assignment to particular students. So halimbawa ikaw, you will be assigned to room 301, ang isa naman room 302. You cannot choose your patient except the CI, because he will be the one to choose your patient depending on your skills. So do not complain if your CI will give you 5 patients and the other student will only have 2 patients. Kasi that if you have 5, that means you are doing well with your skills and the CI is confident that you can handle the 5 patients. Pag binigyan ka ng isang pasyente lang, ha, you have to be sorry to yourself. Ay, hindi talaga ako magaling kasi isa lang ang pasyente ko. Pero ang iba, baligtad ang estudyante. Pag binigyan ka ng isa, tuwang-tuwa yan. No? Pag binigyan ka ng dalawa, galit na galit. No? Galit na galit sa CI. Pero wala kang, that is part of your learning. No? Isanay mo na yung sarili mo. No? Kasi if you practice having a difficulty, no, in the ward, if you become a staff, you can handle the difficulties already. Diba? Kung sanay ka na binigay lahat sa iyo, pagdating sa ward, na mahihirapan ka. Okay? Then after that, the CI will give you special assignments. Then after that, mag-conduct siya ng pre-conference. Sa pre-conference, doon niya ibigay yung assignments as well as special assignments. Then after that, you will have your ward orientation. This is on the first day of duty to know where is the location of the different ano ang location ng setup, no? Kung saan mo makita yung mga basurahan, saan mo makita yung hamper, where can you find the oxygen tank, where can you find the linens, and so on. Okay? So, that's it. And then after that, the break time, sometimes the CI will assign somebody during the pre-conference to make a schedule for the break time. But you cannot have a break unless you are done with your activity. So if halimbawa vital signs by 8 o'clock, so you cannot, and then natapos ka ng 10 sa iyong vital signs. So you can take a break. Pero you started at 8 o'clock sa vital signs mo, 5 yung pasyente mo, natapos ka ng 12, you cannot take a break. No? Kaya before you go on your duty, you have to have a full stomach. No? Bawal sa nursing na walang breakfast. No? Bawal din sa nursing na hindi ka pwedeng mag-lunch. Sabihin mo sa CI mo, ma'am, din ako mag-lunch, mamaya na ako after the duty. No. The more you will have your extension. Hindi pwede yan. No? Kasi baka mahimatay ka dyan, mauna ka pa sa pasyente. Okay, then by 12, no? Ayan, mga bedside care, whatever. Kung depende sa schedule of activities ng CI mo. Okay? So within your 8 hours duty, you will have your health teachings within the 8 hours duty. Hindi siya nakaspecify on specific time at 9 o'clock. Doon ako mag-health teachings. Hintayin ko pa ang 9 bago ako mag-health teachings. But you can give your health teachings as soon as you have your rounds and then you have the time that you will have your bedside care. You can give your health teachings anytime. No? Okay, then lunch break, then 30 minutes. Okay. So, dati ito, 30 minutes. Yes, 30 minutes na lunch break. Ang snack na break is only 20 minutes. Then, after that, continue with the duty. So, with the duty, actually, 7 to 3 tayo, no? But we will end up sometimes at 1 o'clock, depende sa instruction ng CI. We will end up sometimes at 12 o'clock kung mayroong mga meeting ng CI. Then we will end up sometimes at 2 o'clock. Pero ideally, it will be at 2 o'clock, at 2:30, no? Because it is the staff that will continue your duty from 2:30 to 3. So, ang charting mo, ang documentation mo is only up to 2:30. Pag sinabi ng CI, documentation will be up to 1 o'clock only. So, you follow. Only up to 1 o'clock ka. Pag sinabi ng CI, documentation will be up to 2:30, so hanggang 2:30 lang kayo. So, i-end mo talaga what is being instructed. Kasi by 1, ang duty mo is 7 to 3. After 1 o'clock, it is already the staff that will follow up the patient itself. Hello, questions? Questions? Wala na.
None, ma'am.
None, ma'am.
None? Okay. Next, the endorsement as well as evaluation of the NCP. No, this is done sometimes after, depende sa CI kung anong oras niya ibigay. Sa DR, the special areas, we have all the time. No? Kasi lalo na sa DR, wala namang mga anak, walang mag-anak every day. So, unlike in the government hospitals, no? Sa San Pedro Hospital, sometimes wala nga mag-anak eh. Sa SPMC, no, in one duty hours, in 8 hours duty, sometimes 18 mga anak, 20, 23, mga ganyan. So, walang time ang CI to evaluate your NCP. No? Pero meron talaga tayong endorsement at the end. And then travel time, no, if you are coming from Digos, ayan, if you're coming from tawag nito, Tagum, mga ganyan. So, meron tayong travel time. Okay? Next, activities. Okay, these are the objectives, kung ano yung activity mo for that day. Okay. Word orientation is also given to students in the form of short assignments where he or he will assign to a patient to do initial assessment. So you have your assessment, health assessment subject, right? Meron, wala?
Yes po.
Meron po, ma'am.
So meron. So you have to listen what is being discussed because you will use that one in your duty. Imagine ha, ngayon mo yan, tapos next mo pa i-apply. Familiarization of the routine activities in the ward, use of the bedside records, and getting to know the staff members. So, hindi pwedeng, if you are asked by somebody, kilala mo ba si Mrs. Atillo? No? Asan yung nurse na Atillo? Hindi pwedeng i-describe mo lang. So, no, dapat kilalanin mo ang mukha. That is why we have the orientation. Para if the patient will ask, if the doctor will ask you, no, you can really identify who are those persons. Sa doctors, no, sa doctors we have difficulty to identify all of the doctors because we have different doctors coming from different hospitals. No? So, yung ating mga consultant which are assigned solely in the San Pedro Hospital, then you have to familiarize yourself with them. Pag hindi mo kilala, then we have to ask. You have to ask your CI. Hindi lahat ng CI kilala din lahat ng doctors. So we can ask together with the staff. No? But do not hesitate to ask questions if you have questions. No? Do not, if you are in doubt, do not hesitate to ask questions. And do not rely na you know already. You have to have the presence of your clinical instructor. Lahat ng gagawin mo. Even in the recording, up to the recording, nandyan pa rin ang CI mo. Before you write everything on the patient's chart, you have to write your documentation in your notebook and it will be checked by the clinical instructor and then you transfer that one into the chart. No, ganun ang ating trabaho. Hindi tayo magdirekta. Okay? Then, student assessment in terms of the following, what they know, their strengths and limitations, barriers to learning, positive influences, and perception of the teaching learning situations. So, what they know, this is through the return demonstrations, mga ganyan, no? Then we have quizzes in the ward. We have also discussions in the ward, pre and post conferences. Sa post conference, usually this is the time where the clinical instructors will give a quizzes. So expect every day to receive a quiz. Hindi yung, ma'am, di mo manggisabi. No? Hindi yan also sa nursing. Ano yan? Anytime, anywhere, pwede magbigay si teacher ng quizzes. Okay, to identify the strength as well as the limitations, So the teachers can tap your shoulder if you're doing well in the ward. So pwede kang iganyan. Oh, very good. You're doing well in the ward. Maganda yung pagkagawa mo ng procedures. No, pag mali naman, anong gawin ng CI? Sigawan ka? No. Hindi ka sisigawan because the patient will never trust you anymore. So, sikreto lang si teacher. Sikreto hinihila yung uniform mo. Mali na imong gibuhat. Or sometimes, before you go to the patient, doon mismo sa station, magre-review kayo ni teacher on a particular procedure. Ma'am, mag-catheterization or ma'am, mag-beds, ano ako ma'am, tawag nito, mag-extract ako ng blood for sugar test. So doon pa lang mismo sa station, you will have the practice so that by the time you arrive to your client, you are confident already to perform the procedure. Hindi yung pagdating doon sa procedure, ma'am, ikaw na lang, ma'am, pwede man ko kambal, lumutanaw sa ako sa imo. No? Ang pasyente, dili na mo trust sa imo, ha? So, pasikreto lang tayo. Minsan, dinadaan sa dilat ng mata, no, ng CI. Didilatan ka, ibig sabihin, muli ako. Ma-unsterile ka, didilatan ka. Mga ganyan lang. No? Pero you have to, that is why before you go on duty, you have to have your objective for the day. No? Para alam mo kung ano yung dapat mong matutunan for that day. Barriers to learning, so we will also identify bakit itong particular student na ito nahihirapan sa skills. Ma'am, dili man gud ko gusto mag-nursing. Ako man kung mami ang gusto mag-nurse. Pero ako lang nag-enroll. Okay, gusto mo niya mag-nurse. So ako nag-enroll. Ako nag-eskwela. No? So there should be identification of the barriers also. That is why we are always telling to our student, if this is really your will to become a nurse, then you have to find a remedy. Pero if you are forced by your parents, then you have to tell them honestly. Because taking up nursing is not a joke. No? It is a waste of money as well. And the time, lahat, no? It is very taxing ang trabaho ng nurse. After graduation, hindi yun. Masarap that you pass the board exam, di ba? Even kahit na, lalo na if you are already the top notchers, it's very, it is a good feeling. Pero you have to evaluate also yourself. Ito ba talaga ang gusto ko? Pag hindi mo gusto at pinilit ka lang, I'm telling you, mahihirapan ka. You have difficulty to accept kung ano man yung ipagawa ng CI sa iyo. No, kaya ang iba minsan, pagdating ng second year, no, they will really tell the CI, ma'am, di ko gusto mag-nursing. Bakit ka nag-enroll sa nursing? Ako laging mami ang gusto mag-nurse. Pero hindi man siya naka-nursing noon. So ako na lang ang gusto niya mag-nursing. So are you willing to sacrifice for your mommy? Hindi. So we have to call your mommy. No, we have to talk. And then enlighten the mind of your mother also. This is nursing, no? So hindi din pwedeng pilitin, no? I really experienced that one with my students before. So, talagang hagulhol ang iyak, no? Pag-duty sa ward. Sabi ko, bakit ganyan ang iyak niya? Parang pinalo. Sabi ng kaklase, ma'am, ayaw lagi niya ng nursing, ma'am. Bakit siya nag-enroll? Gusto niya ng mami niya, ma'am. Nasa second year na siya, ha? Sabi ko, 2 years more, matapos ka na. Tapusin mo na lang ang nursing, then after nursing, you can find another course. Kung gusto mo maghanap, kung gusto, ayaw mo talaga ng nursing, ayaw na talaga niya. So, tinawag namin ang parents. So, after that, nag-shift yun siya. No? And now, she is already a successful entrepreneur. So, doon talaga ang linya niya. No? Pero entrepreneur siya. Sabi ko, nag-entrepreneurs ka na lang sana. Entrepreneur siya. Ang kliyente niya, taga San Pedro College. So, doon pa rin siya sa San Pedro College bumagsak. Okay? So, positive influences. Okay, this is very true. Because most of you have your titos and titas in the US, no, that has positive influence with you, no? Kaya you are performing very good in the ward. Meron ding mga ganyan. Perception of the teaching learning situation. Ano yon? Ang tingin mo dito sa ating skills, no? So, iba-iba, we have to assess the students how they look at this one. May iba, hindi pa nga nakapag-start ng demonstration, they started to cry already. Eh, bakit kami? Ma'am, nahirapan na ako sa demo, no? So, may iba naman, they're doing well in the demonstration because they really love nursing. So, merong mga ganyan. So, meron talagang assessment si CI, ha? So, merong iba na you cannot tell na ang iba naman, medyo bugoy-bugoy yan, pero they are trying to make very good in the evaluation. Sa quizzes, they're doing well. Sa exams, doing well. Pero yan, hindi, parang hindi seryoso. No? So, teachers will inform you of your strength and encourage you of your, kung ano man yon ang magandang gawain na dapat i-enhance. No? Okay, daily activities, making the students assignments. So that we have an individual assignment. This is given to you during the pre-conferences, no? After the endorsement. So sometimes bibigyan ka ng isang patient, sometimes tatlo ang patient mo, sometimes lima, the worst. Minsan isa lang, pero isa lang with all the gadgets attached. No? So mga ganyan. So one student is assigned to one or more patient, limited to only a certain aspects of care of or it may be a total care. So, depende. Because sometimes you are together, excuse me, sometimes in the ward, no? Because isa lang ang ating affiliation institutions, San Pedro Hospital lang. Sometimes you are together with the third year. So, meron kayong locus of responsibility. So, ang third year will be in charge of the documentation. The second year will be in charge of the bedside care. Yung mga ganyan. Dual, when the student is assigned to one or more clients along with other student and staff members. Yun ang sinasabi ko. Minsan, meron din sa isang pasyente, they will have their special nurses. Private nurse, I mean. So, ang assignment mo, meron kayong locus of responsibility. Advantage, so there is a decreased anxiety for the student nurse and that fosters truly supportive relationship and the staff members serve as the role model. So it will deload, now with the dual responsibility, it will deload the nurses because there is a student nurse as well as the student nurse do not have difficulty in the task because you are with the staff nurses also. Okay? Then alternative assignments, student is assigned as help as ano na ba ito? Hindi ko mabasa. Ay, sorry. Student is assigned as a help to hospital setting who works in a supportive capacity for several other students. The individual assignments in particular patients. So, alternative assignments. So, halimbawa, assign ka ngayon for with 2 patients. So, bibigyan ka pa rin ng another assignment. You are assigned with the special, yung sa master list of the vital signs. You will be the person in charge to monitor all your classmates about this master list. No? So, yun ang mga alternative assignments. Then, we have preceptorship. No? So, preceptor is a tutor. So, if you are with the third year, sometimes your tutor is the third year. So, yan, meron kayong mga procedures na ginagawa na the one who will accompany you instead of your clinical instructor is the third year. Because you're considered as fresh, as novice, and the other one is considered as with experience. Na pwedeng third year students, pwedeng fourth year. Kaya meron tayong PCI for the fourth year level. They will be your tutor sometimes or it might be the staff member itself. This will be posting these assignments in the predetermined location and helping students to learn also. Kasi minsan, there are some students that are hesitant to call the attention of the clinical instructors. Mas relax siya doon sa fourth year. Okay? Conducting a clinical laboratory session, teachers' activities includes pre-conferences. This is before or after the endorsement before you will go to your particular student, a patient. Working with the students during the preparation of the clinical experience. Case study method. So you will you will get the data from your patient because you will use that one in your case study, and it will be by group, and students will be merong assigned na particular students with the particular disorders. You will have your data collection, and then at the end, you will diagnose your client. So nursing care plan, this is actually individual. Individual care plan that focuses on individualized patient care based on the nursing diagnosis. So lahat kayo are expected by the clinical instructor to have the NCP. But of course, before you do it, during the orientation, it will be discussed by the clinical instructors how to go along with your NCP as well as with your case study method. Questions? Hello?
None, ma'am.
Okay. A definition of diagnosis and its related pathophysiology. No? Uh, this is also done by the students. Do some research as well, past or planned surgical procedures. Kung ano yung halimbawa na OR ang patient mo, you will get the data from the OR. So marami kayong gawin. Treatments require and identify the related nursing responsibilities, nursing care responsibilities, no? If you give your health teachings with rationale or rationales, describing medications. So with the medications, before you can give to your client, before you proceed in giving, this will be after the pharmacology subject concept, I mean. So you will recite in front of your CI in the ward what is the medication all about, the action, the desired effect, as well as the mode of action, and the indication, the classification, madami, no? Side effects, major implications, lahat sasabihin mo doon sa CI mo. How does this medication process into the body of the patient? So yun, lahat, i-memorize mo yan. Sasabihin mo. Mahirap, no? Mahirap, pero you are allowed by your CI to read the drug handbook. If you have, you are allowed by your CI to search in your cell phone if it is about drugs, no? Kasi i-recite mo yan doon sa CI mismo before you can give the medication itself. Hindi yan ganun kadali na ibigay mo na lang. Okay? This is done prior to administration of medication so that by the time your patient will ask you what is that particular medicine, you can give an answer, correct answer. No? Kasi kung magpunta ka ng pasyente, punta ka sa patient mo, and you don't know anything about the medication, when the patient asks you about it, ang sagot mo, anong sagot? Sige daw, anybody? Anybody from the group? Pag tinanong ka ng pasyente mo, para unsa ng gamot, miss? Anong sagot, pe? Miss Bungkawel, can you give me an idea? Hello?
Iingon ang ma'am, ang purpose sa tambal ma'am, halimbawa maghatag ka og kanang
Halimbawa, mefenamic acid. Oh, sayon man na, no?
mag-ingon ka nga for ma'am kanang for bacterial infection ba na ma'am, kay mostly mo pang magbunot kog ngipon ma'am kana ang ginapainom sa or pain ma'am.
Okay. So that is why you have to know thank you. That is why you have to know what is that particular medication. Halimbawa, mefenamic acid. Anybody knows what is mefenamic acid?
Pain relief, ma'am.
Okay, pain reliever. So, pag tinanong ka ng pasyente, Miss, para unsa nang akong tambal imong gihatag? Miss, unsa nang tambal? Miss, mefenamic acid, sir. O, para unsa na siya? Pain reliever. Ano tagan man ko ana nga wala man koy pain? So you can answer. Diba? Ay sir, gikan manggug ka sa operating room, no, gioperahan ka. Pag inoperahan ka kasi, merong expected natin na mag-inflame yung wound because of the WBC that will surround the wound to protect the entrance of microorganisms. So binibigyan ka ng mefenamic acid para ma-prevent ang inflammation. Kaya kung naamang yung inflammation, sakit. Diba? Kung maghubag, sakit. Tama? Dili. So, mga ganyan, no? So, before you give the medication, you will recite in front of your clinical instructor in the ward itself or within the station. Kahit na merong naglalakad-lakad dyan, may doktor nakikinig sa iyo, mag-recite ka. This is in preparation for you when you go to your patient, when the patient will ask you about the medication, you can confidently answer back the patient. Hindi mo pwedeng sabihin, ay, gi-order mo na ni Dr. Sir, imna na lang na. Na? Pag gano'n ang sagot ng nurse, ibig sabihin, the nurse itself doesn't know what is the medication for. Kaya huwag niyo iparinig sa akin yan pag ganyan ang sagot mo. Then describing each diagnostic test, normal values being tested, existing variations and related nursing responsibilities. Example, nag-urinalysis ang pasyente. So, pag urinalysis, lumabas ang result. Nakita ni mo dito, halimbawa, na siya bacteria, na siya pus, ganyan. Yan apagid siya traces of protein. So when the patient will ask you unsa man ang result miss ngano man nang naman ay plus plus unsa na siya, no? You will know also how to answer the patient. So this one, the diagnostic test, you will also recite to your clinical instructor. If the CI will tell you what is the why the patient will have urinalysis, i-recite mo yung sarap ng teacher mo, no? Para confident ka na pagdating doon sa pasyente if the patient will ask about it. Okay? Practice sessions working with the students at the time of actual patient care. The teacher must be able to provide support and supervision, yet allow the student enough freedom to practice the skills and decision-making abilities. Okay, especially during bed making. Minsan kasi, when you do the bed making, bagal masyado. Diba? You have already the return demonstration in the Fonda lab. No? The CI are expecting for you that you can perform the task. Kaya lang, we are not expecting na ganun kakabilis. No? So the CI will help you to do this particular procedure, pero you will be the person that will do most of the procedure. Na dito si CI mag-assist sa imuha, no? Magtabang sa imuha pag pack, whatever. Pero ikaw yun ang, what you call this one, you will be the one to manipulate which one are you going to do first. No? To allow you to decide kung ano ba yung tama na gawin. Okay? Then, working with the student during follow-up activities, which includes post-care conferences. So, post-care conferences, this will be done after your duty. So if the CI will tell you to close to end our duty by 1 o'clock, after 1 o'clock, you will have your post conferences. So this is the time when the teacher will give some quizzes, as I have mentioned. This is the time that the clinical instructor will also tawag nito, yung i-correct kung ano yung dapat i-correct niya before the procedure, no? O kanina, nagigil kayo dyan in the ward, no? This is not the place for giggling because patients are suffering. So, doon i-correct kayo. Doon na siya. Yung mga problema, paano i-solve, yan. Provides an ideal time to point out application of theory to practice group problem solving and evaluating nursing care. 1 or 2 students will share the experiences with the members. So doon, ma'am ganiya ma'am, naglisod ko ganiya kaya ako pasyente dako kayo. Nga ako gamay lang kaayo ko. Pero I am very happy with the help of my classmate na si ganito, ayan, merong mga appraisals, no? So that is normal, no? Hindi yung kung sometimes ang nakita ng teacher yung mali, hindi yung never say na mali lang talaga nakita niya. So maybe next time makikita ni teacher that you're doing good in the ward. This is also the time na mag-uplift si teacher with your performances. Okay? Log and diaries, students use to have reflection process to think about the experiences and communicate with their instructors. So dito, ma'am, naglisod ko ganiyan sa akong pasyente. Daghang kayo siya gadgets, napay dextrose, napay catheter, napay ventilator and all naka-attach, mga ganyan. So nursing care plans, it was mentioned already, every day, daily, you have to have this one. For a quick plan of care, no? Ginagawa natin 'yan. You don't know that this is already a plan of care, pero you will have the written plan of care to be submitted at the end of duty sa clinical instructor. Nursing or walking rounds. So ito yung habang nag-duty kayo within 8 hours of duty, may nakita si teacher na magandang procedure that you have not seen in the classroom setting. So the clinical instructor can call all the students and to have this particular patient as your target na to discuss about the diagnosis as well as the disease of the patient. Okay? Instructor point out certain equipment, no? Kung halimbawa, ventilator, first time tayo nag-duty in the ward and then this is the first time that the patient is having ventilator, no? So I can call all my students just to show that this is a ventilator. Para the next time you can see it, you know already what is it, no? Okay? This is oxygen, mga ganyan. Never inside the patient's room, but outside dyan lang sa labas. You can discuss inside, but you have to use medical terms with the permission of your client also. Okay? Shift, report, student nurse listens or may be given an account of what happened during the shift. So at the end of duty, so pwedeng CCI will point somebody to discuss what have you experienced on the day. Okay, evaluation of student learning and performance in the clinical setting. The teacher give feedback and suggestions about their performance. So pwede ako magsabi, I miss, Mr. Tortor, no? You are very good in bed making, pero mabagal masyado. Next time, bilis-bilisan mo because you have another you have another procedure that you will do. So, mga ganyan. Okay? Or, si Mr. Kinyo, very good ang performance this day, no? Encountered niya yung patient is very depressed. The student is able to make the patient calm. Halimbawa, nagkagubot mas dito sa room. Pero siya ang nakapa-relax. Ayan, mga ganyan. Okay? Ay, sorry. Kabilis. Any question? Hello? Hello?
None, ma'am.
Nakasabot ba? Paspas kay si ma'am.
Okay lang yan, ma'am.
Hindi. Paspasan ako ni. Gituyog yun ako paspas. Okay, para you can start with your teaching plan already. Ha? Okay, ilang meetings na lang tayo. May 21, 2, 3, 4. 4 meetings na lang. Okay? So next week, we will have asynchronous. So you spend the time schedule for your project. Okay? Hindi pwedeng tulog-tulugan, ha? Okay na? Questions? Ano ba? Okay.
None, ma'am.
Ma'am, may isend ka po na format for lesson plan po, ma'am. Like yung sample format po.
Wala na. Yung sample yun na yung sample. Yung i-discuss ko. Meron mang sample
Okay po,
doon
ma'am.
yung circumcision. Okay na? So, I will dismiss you early. No? Paningog mo kung paspas kay kuha. Di naman paningog. Okay. Ayan. Wala nang questions. So, we will end up to this. I still have another one topic, the evaluation process. No? Yun na lang ang pinaka-last. Then, hopefully, tapos na tayo. Okay. So, we will have a prayer, Miss Barillo. Everybody open your cam. Andiyan na si Mr. Kapulong. Mr. Kapulong, are you in? Absent. Absent si Kapulong. Wala yun. Miss Dacalos, are you in?
Nandito na po, ma'am.
Okay. Mr. Ferrer. Mr. Ferrer, are you in? Absent si Ferrer. Mr. Legas. Diyan na, no?
Present po, ma'am.
Okay. Okay. Absent si Kapulong and Dacalos. Okay, so let us pray. Miss
Let us
Carvalho.
pray in the name of
Miss
the Father,
Marino.
the Son, and the Holy Spirit. Amen. God, thank you for this wonderful day. Thank you for the lessons that you have taught us. Thank you for our teacher, for the opportunity to be in this class for today, to have learned everything that she has taught us. Hopefully, may you please let us remember and apply all the learnings that we have learned today in our pursuit for our course in nursing. May you always guide us and protect us from every evil and help us in every struggle that we may face. Amen. In the name of the Father, the Son, the Holy Spirit. Amen.
Ma'am,
Bye,
present po
everybody.
ako.
Sinong ka?
Miss Dacalos, ma'am.
Dacalos. Bakit ka nagsagot?
Ay, nagsagot po ako, ma'am, kanina, ma'am.
Oh, hindi kita narinig. Okay. Sige, you can go na.
Bye, ma'am. Thank you,
Bye, ma'am.
ma'am.
Thank you, ma'am.
Bye, ma'am.
Bye.